Hello, my name's Jason White. I work for the Mid-America Regional Council. It's a council of local governments around Kansas City, Missouri. I do emergency medical services consulting, and the projects I get into get me into a lot of legislative activities. The one I wanted to spend a moment on today is a potential of revenue enhancement for ambulance services and fire department first response organizations that really comes from some federal law regarding how to enhance revenues related to Medicaid. And these ideas really go back to the 1960s around federal laws providing additional funding for hospitals, public hospitals that are taking care of the poor and Medicaid patients. We have been watching for an opportunity to promote a provider tax, commonly known as an FRA, in Kansas. Hospitals and nursing homes have it in place and are generating multiple millions of dollars a year in additional federal revenue for their organizations. Missouri has a successful provider tax program for ambulance, but the political environment in Topeka has not been conducive to moving forward that legislation in the last few years. Within the last 6 months, we've become aware of a program that really is getting emphasized in California and Washington called a Certified Public Expenditure, a CPE program. And the California Fire Service has championed that, and so here in Kansas, the Kansas Association of Fire Chiefs and the Kansas Firefighter Association, the State Council of Firefighters, as well as the Kansas EMS Association and KEMSA have endorsed pursuing the creation of a CPE program, or another acronym, an IGT program, Intergovernmental Transfer. All three, FRA, CPE, or IGT, are all cousins within the federal law that allows for programs that let you draw down additional federal dollars to support what Medicaid services you provide. The CPE, which is the one that's most likely to get some activity this next legislative session, is actually going on now in 6 different states around the country to support ground ambulance services. And so in the conservative states of Texas and Indiana and North Carolina, a little more similar to Kansas, we've got some excellent examples. The basic construct of a CPE is you recognize how much you are spending, what your actual cost is in providing services to Medicaid patients, and you can get a return from the federal government for that cost. Now you've got to be, under a CPE, you've got to be a government-related ambulance service. There may be an opportunity to help out services that are subsidized, but it is primarily directed at government-based ambulance services. Provider tax is an all or nothing. All the services have to participate, but it includes all the services, the non-for-profits and the privates, as well as the government services. All 3 of the opportunities are complicated. They probably require legislation. They most definitely require the political acceptance of the governor's office and the Kansas administration and the Kansas Department of Health and Environment. But currently, with the amount of folks sort of piling on board between KEMSA and the fire chiefs and the Kansas Association of Counties that we expect to endorse and the Kansas Hospital Association, there's some really growing support to utilize one of these programs that's found success in other states and could quite literally bring multiple millions of dollars a year into the coffers of our ground ambulance services here in Kansas. And in the context of some of the others, maybe even provide assistance for fire department first response. If you've got some questions, please feel free to drop me an email. You can find me at Jason, Jason, .White, WHITE, 3254 @gmail.com. Thank you.